Hey, everybody, if you can hear me, let me know. I was inspired to start doing some more live chats about wound care. My goal is to do one a week. So if you have any topics that you want to discuss, please let me know what that is. I would love to address needs that you have at home. Tonight, I'm going to talk about debridement, and it's something that I see folks post quite often about removing dead tissue, and either they're unsure if that's what's supposed to be doing, or they have some anxiety about it, or it's just not going fast enough. So here's the thing. Dead tissue in a wound needs to be removed. It can look yellow, black, green, smelly. Those would be like green and smelly would be signs that you have an infection brewing in there. So absolutely, you need to make sure that you are getting that taken care of first. Or it can look black and thick, like we call it eschar, but it's a like thick leathery type covering over an area. And I do have some pictures, so I'll show you that as well. And I have my trusty little model here. So just so you can, where is it? I'm talking about this dark area there. So this kind of thing needs to be, all this would need to be removed. What we're trying to do when we debride a wound is get down to the good stuff, which is underneath. Now, if you have just had surgery or an incision and it starts to go black, that may be signs that the edges are failing. Now, if you are wearing compression or something like that, that is, you would want to take the compression off, because there may be not enough blood flow getting to the area. And so the compression is actually causing it to fail. And then we're going to wind up where you open up and we're going to have something that looks more like that. So I've definitely seen both of these cases. I've seen folks talking about it on Facebook and things like that. I've seen people come to me looking for advice on what to do. So if you've had a surgery, you're wearing compression, your incision goes black, number one, call your doctor. Number two, take that compression garment off for sure. And if we're talking about, I'm talking about surgical type incisions there, but this can also happen on a toe or a foot, a limb, where you've had either an injury or something like that. Your wound can go necrotic, where there's a lack of blood flow and circulation in that area is dying. So if you have any comorbidities like diabetes, poor circulation, PVD, things like that, you want to be vigilant about what's happening on your lower extremities. If you have a wound, you want to keep an eye on it, or have a loved one keep an eye on it for you. If things start to go black or dark or green, pussy, smelly, that's all not a good sign. And you don't want to wait. You want to get medical attention as soon as possible. So figure out, call your doctor first, call your insurance company, find out what is the best way to get medical care, and go get yourself some medical care. But let's say your doctor decides that they want to do a debridement, or you feel like you want to do a debridement and they are saying no. Your doctor is taking into consideration everything that's going on with you, your whole body, not just what's going on with the wound. There are certain situations where maybe debridement would not be appropriate. So it's not for everybody. But if debridement is something that is going to be done on you, then there are a few different methods. Not every debridement is going to be like a surgical type debridement where they're going to take you to the hospital and put you under and debride something. Some of it's going to be a bedside treatment. It can be done with scalpel, curette, scissors, where they're just going to cut away the dead tissue and nothing else. It can be part of just a treatment where you go into the doctor's office. It can be something that's done bedside. It could be something that is done in your home if someone skilled is coming into your home to do wound care for you. It really depends on practice act who is going to perform a debridement on you. It could be a doctor, nurse practitioner. I'm a physical therapist. We can do debridements as well. Some nurses can do it. It all depends on practice act and the clinician training and their comfortability as well. And also facility protocols might come into play with that as well. So who does your debridement might depend on where you are and who's providing the care. Sometimes you've got people coming into your home and they don't feel comfortable. So the only way that you can get a debridement is by going into a clinic or to an outpatient center, a wound center. It really depends on lots and lots of factors. What's going on with you, what your insurance will allow, and the providers and who's there. So really lots of factors, but doing a debridement like physically is not the only way to get rid of dead tissue. We can use autolytic debridement, which is where we're using a moist wound dressing where we're covering the area. So we're using something moist and we're covering the area, and then this hard stuff will start to come off and then we'll get lower and lower. It's a much slower form of debridement than if someone were to come in and just remove it for you, but it will work as well. What you want to do is make sure that you are keeping it covered in the meantime. Keep it covered, do the dressing. If you have access to the enzyme, that's going to work faster than, let's say, a hydrogel, a plain hydrogel. If you don't have access to products, you can reach out. I might be able to get you in touch with people that can get you products that you're looking for or help you figure out what products are best. But keep it covered, and that will allow your body to start to slough that dead tissue off itself. When you are, let's say you're taking a shower or you're going to clean the wound, you can use gauze. Tuck that in there. So you can use a gauze and you're going to try to like wipe it out a little bit, get that goo and mush it out. You want to try to avoid like taking it from here to here. You want to take it from the inside and scoop it out. You would use a new gauze every swipe, and you would let the water run, especially if you're in the shower. You're going to make sure you're going to clean it really, really good before and after you do something like that, and then you're going to cover it back up again. And the other thing you can do to help your body heal itself is try not to use any drying products. So try not to use alcohol or betadine, things like that are antiseptics that are meant to like kill all bacteria. Your body does produce some of its own bacteria, and moist wound healing is better than dry. And if we have the surrounding skin too dry, it's going to start cracking, and then we're going to open ourselves up to more infection, and that just gets bigger, bigger, bigger. So there's lots of things that can be done. Make sure that you are eating well and drinking lots of fluid and getting some mobility, whatever you can in there. Let's see if I can show you, share my screen. and show you some pictures. Let's see if I could do this. Let's see. I'm going to go to pictures. These are just some examples of some wounds. Hopefully it opens. That could potentially use a debridement. Oh, are you going to open? I should have opened all these before. I'm sorry. Okay, so let's zoom in a bit. So this is right after a tummy tuck. This area is starting to dye. It looks pretty dark in there. This is someone that if they were wearing a compressive garment, I would say they should stop. The stitches are in there. So right now, just trying to encourage blood flow, keep this area clean and covered is probably what I would do. And I'd give it a little bit of time to see how it progresses, because if we can get it to just kind of reabsorb and recede on its own, that might be good. Although up in here, it looks like it may be starting to open more. So this is something I would keep a very close eye on, this one, but I wouldn't put too much wet stuff on there because we don't want to cause the whole thing to open. That's just my opinion on that. I don't know if I can open two at once. Oh, so this one was a client that I worked with. She had a lipo burn, so it starts up here. It was dark. She started to put, I believe, because this area was open in here, she started to put Silvadene on that area. And eventually, because the burn was deeper, it kind of rose like this surface area, eventually sloughed all off. So I know she was trying to remove a little bit of this tissue on her own. And eventually, we're getting down there. She's been keeping it moist, keeping it covered, doing all the right things for nutrition, and things are progressing like you would expect as you start to remove dead tissue to get to the stuff on the bottom. Things may look deeper than you expect at first when you get down there. Here's another, I don't know the cause of this one, but you want to make sure that no matter what's going on, you're also taking into consideration signs and symptoms of infection. So this makes me a little nervous because not only is she like swollen and this tissue is definitely dying, it's already dead, but this area looks to be pretty inflamed. It's red, it's pussy looking, it just looks angry. So I believe this woman decided to go to get some urgent medical care, and hopefully everything is progressing well. So let's see. So that was just a few pictures. Hope you're ready for that. I didn't warn you I was going to show you some pictures. But so bottom line is that dead tissue needs to be removed in order for you to progress to healing. And there are a variety of ways that dead tissue can be removed. They can be cut off. It could be, you can use products to do it. Or it can be kind of rubbed off or scraped off. So the faster we can do it, the faster you are going to heal up your wound, and the less your scar will be too. So if anyone has any questions, I'm going to do these live. If you have a topic that you would like me to discuss, please let me know. Post something below. You can send me a message directly. If you have any questions, reach out. I am doing consultations. We are doing mobile debridements in New York, in the capital region. And if anyone needs anything, please feel free to reach out. If you know someone that could benefit from hearing any of this information, please share it. I appreciate it greatly, and we'll see you soon. Thanks.